computer. Hi, Belinda. Oh, look at those pictures. If you can just put your camera on, what we're going to try to do for our post-practicum is try to make them as close to a face-to-face post-practicum conference as possible. So if we were really having this in a room, we wouldn't be able to not show our faces. So if you can put your cameras on during these meetings, that would be great.
Okay, let's see how
so it's down at the bottom left corner. It looks like you got it, but just for everybody who might be listening to a recording, the bottom left-hand corner, there's a mute button, and there's a video button. So while I'm talking, you might just want to mute your own microphones. So if there's any kind of background noise, it won't be too disturbing. And then when you want to talk or anything, you just hold your hand up like this and then unmute when you speak. If I ask a question, you can give like kind of a thumbs up, a thumbs down, or we can do some nonverbal communication as well. But I just wanted to say hello, and it's great to see you guys and put a face to a name. So we will be having these meetings. You know what? I didn't really count up how many times we're going to have them, but I will open up the calendar and share my screen, and we can look at that together. So let me share my screen here. And I have two screens, so sorry if I look over there sometime. So I will share this. Let's see. And we can go into a new tab, dashboard. And we got 543, everybody's favorite class. And here's the announcement that I sent out. And if we go in here to the course calendar, this kind of gives us an overview of everything that we'll be doing. And so I put all the dates and I checked them today of when we'll be having these post-practicum conferences. So here's the first one on the 20th, that's today. They are almost every other, but we do have a spring break in there, so that kind of pushes it back 1 week. So we'll have one here on February 3rd, February 17th, and then there's spring break, the 2nd through the 8th of March. And then you'll have your meeting 316. So they're all right there in the calendar. If you use your Google Calendar and you want me to send you an invite to this, I can do that. Just shoot me an email. Do any of you guys use Google Calendar? Eileen, you're saying yeah, you do? Okay, if you like to, I always use my calendar, so I have this in here. So if I click on, let's see, a meeting here, it has the link to it right in there. And sometimes people will attach agendas to these invites too. So that is kind of a helpful thing. Somebody sends you an email, you accept the invite, and it goes right into your calendar. So this is pretty typical. I think that we have about half our students at this point in their practicums and all going, and we have maybe half that are still getting all their documents together. Usually by this time, everybody does have an idea of where they're going. So for this meeting here, why don't we just talk a little bit about how that all went. And I can go in, I think I have another announcement here that was sent out on the 16th. Let's see. Practicums here. And so this one in here, I just wanted to go over, these are the steps here for you to complete before you actually start your practicum. You have to make sure that all your Castle Branch requirements are up to date, that Stephanie Daniels, the clinical placement coordinator, has agreed upon your practicum setting. We have to make sure there's an affiliation agreement in place. Confirmed with Stephanie Daniels that I just said that affiliation agreement. Provide your preceptor with a preceptor agreement form. You give that to the preceptor, they fill it out, they attach their CV, and then you can upload that into Canvas. And then once I've graded it as complete, that means for your preceptor agreement, you're okay from my end, and you just have to make sure that Stephanie gives you the okay as far as Castle Branch. So we really like Castle Branch to be finished by now, and then we would like for you to really start by your practicums, also known as clinicals, by week 4. We can push that to week 5, but after that, it's going to be really difficult for you to complete everything on time. So I think that's really all I need to say to you guys. Why don't we open it up? I'll stop sharing here so I can see y'all. And why don't you guys just go through and maybe say a quick introduction. I do want to say thank you to all of you who are here. It is an expectation of this course that you come to these these post-practicum meetings. So these meetings are part of the clinical/practicum experience, and your attendance is reflected in your overall grade. Just in this course, you have to pass both the didactic or the classroom part of the course and the clinical, also known as practicum, part of the course. So you have to pass both of those in order to pass this course. So, Ivy, do you want to start and just say how your whole experience has been so far? And if you have any questions, I can answer for you, and kind of maybe tell us a little bit about where your site is and yeah, where you are with that.
Okay, sure. My name's Ivy, and I'm doing my clinical at LEC USC Medical Center. I didn't get a confirmation email until today, I guess because they had sent it to an incorrect email, but my preceptor is a house supervisor there. And so I guess from this point, I'll be able to actually start with the clinicals and with all of the assignments that are required. So,
and I noticed the name of your preceptor had a DEM manager after that. What does that stand for?
He was a Department of Emergency Medicine.
Okay. Got it. At City of Hope, they have Department of Endocrinology and Metabolism, Department of Diabetes, Endocrinology, and Metabolism. So that was DEM. So I wasn't sure what that stood for. So you'll be in the emergency room?
I actually work in the emergency room, but the clinical setting is actually in the hospital, so in the inpatient setting.
So this person is not your immediate supervisor, though, correct?
He was my immediate supervisor at one point, but now he's actually the supervisor of the house supervisor.
Okay. Very good. And where do you work now?
I work at LEC USC Medical Center in the emergency department.
In the emergency, okay. Sorry, it's a little bit later here than it is there. All right, thanks for repeating that for me. Any questions that you have?
Not at this point that I can think of. I'm just trying to focus on getting everything submitted in time since I wasn't sure that it was actually an approved placement.
Yeah, I think Stephanie sent you an email to iCruise, and that's not your email. So I went back through that today and found that. So, all right, and then you'll just get a preceptor agreement form and then a learning contract, and make sure you put all that into your practicum experience log, and put all of getting those papers together and all of that stuff that you've been doing thus far, and upload that in your PEL-3. And if you guys want to, I'll make sure that I have the ability to comment on your Google Doc PEL practicum experience logs. That'd be great, because then I can just, when I read through it, I can make a comment on it to you. I think that's in the instructions there. All right, Ivy, thanks for sharing. Eileen, you're the next one in the Brady Bunch blocks there, so you want to go ahead?
Okay, so my name is Eileen Yang, and I'm currently actually working. It actually belongs to LA County, but I actually have 2 employee ID. I represent CMS as a surveyor and inspector. I'm in the inspection division. So we kind of go in, do survey. When we do survey, we look into everything, including your facility drain, your ice box, everything. There's certain criteria and regulation that we follow. So yeah, this care transition thing is one of the quality thing that we're looking into. I also used to take lots of complaint. I just switch over to the survey team. But like I told Vincent when I replied him, I'm not allowed to discuss how we do our job. Regulation is in CMS. We basically follow both state and federal regulation. When we do survey, we follow federal regulation. State-wise, generally, Title 22 and all that stuff. So hopefully that answers Vincent's question, because I think where you work, the CEO and whatever, CNO, whatever, they did come to you when I was still doing training at the academy second week to come and talk with us, introduce what you guys do and all that stuff. The academy we have to attend is 4 weeks, and most of them in Sacramento. So my job is actually opposite from the administrator and manager. What they didn't do, we go in and make sure they follow all the path and do the right thing for the patient. Mm-hmm. So if we are doing the care management or whatever to the end, and if the result didn't turn out well, that's the time we go in and we trace back. And if there's any wrongdoing, then we write a deficiency. And most of the facility is not happy to see us. They don't like the deficiency because most of them have CMS contract that will affect to their reimbursement, also recertification. Like tomorrow, I am scheduled to go to a facility to do survey. When we do survey, we go in as a team. When we do complaint and that facility reported incident, then it is individual. When we do training, it lasts about a year, and we are not allowed to go to facility ourselves to do any of this type of work. We always have to go with another surveyor that's already passed the certification. So that's my current job.
So let me ask you just, Eileen, when you go in and you survey people to see how well they do at care management, what kind of things do you look at? Do you have a
That's what I say. I can't really discuss it.
Top secret here. Okay.
That's why I'm asking for the clinical placement, because I cannot just go there.
Right.
They find out I'm surveyor, they're going to ask me a whole bunch of stuff.
Okay.
We are not allowed to touch the patient. That's CMS rule.
Yeah.
We are not
I was just wondering if there
any equipment, nothing. We are just stand off, and we just do observation. We cannot talk with tell them or even give them a hint, say, oh, what you have to do. Like when we observe med pass, I guess everybody very experienced here. We all have the experience of being monitor how you pass the med. Hand washing is a big issue most of the time.
Right.
And then I can tell you one thing is how we calculate your med error. It's every single medication. If you did it wrong, either the wrong time, wrong route, anything, that considered one mistake. And CMS only allow you to have 5% of mistake. And we generally have to observe at least 25 passing. Probably, like tomorrow, the facility I'm going is not really big. So between me and the other surveyor, the other surveyor and I should say that, probably we will observe 2 to 3 nurses and pass to this 25, 26 meds. And 5% of that really not much. So CMS really is pretty strict with that. Yeah.
Okay.
So
I won't make you divulge, yes, any secrets.
it's not secret, it's just a CMS rule because
I understand. Yeah.
they want them to do the right thing themselves. So that's when the administrator and manager come in and tell their staff, hey, you have to do this, do this. So yeah, we look at all that. And as far as clinical wise, I did make 4 phone calls today. And 2 of them told me they don't have programs, St. Gabriel and Monterey, I think. And then Huntington told me most of their preceptor already accept the preceptee and confirmed last October or November. But she said, we can contact with her. I got her information. I'll email Stephanie later. And the other one was the Alhambra Hospital. I talked with the Christian in the nursing coordinator office, and he said that we should just directly contact their CNO, and I got her information. So
great.
I'll forward that to Stephanie, and hopefully she can establish something for me. So that's why
it's been a struggle for you, I know.
Well, I thought Stephanie would give me a list. That's why.
Right.
Because for my position, it is say we're not allowed to take second job. We cannot talk with people. If I work in the hospital before, you have to be 2 years apart before I can even go back to do complaint, investigation, or survey. So that's the pretty strict. Good and bad. We get some of the complaint, and as we all healthcare, we all know it's just ridiculous. But then some of them really literally facility or the staff did do something wrong. So try to be impartial, be fair, I guess.
Yeah. Okay. Well, I hope those pan out for you. Did you try City of Hope? That's kind of close to you too, isn't it?
No, I'm not really in City of Hope. I guess they have another one in Pasadena, but Alhambra and Huntington Memorial is closer to me.
Okay. Well, it's only once a week, so just saying. It's probably only once a week that you have to go there for, 14 weeks or something. So.
Sure.
All right. Well, fingers crossed. Say some prayers.
Yeah.
All right. Thanks for sharing.
Yeah, thank you.
And Belinda, I have you next on the squares.
Okay. Am I on now?
Yes, you are.
Sorry, it's my first time using this. So I gave Stephanie 2 preceptors, but then I found out that the contract was not approved for home health. So I gave her another preceptor, which is Jennifer Hall. She was my preceptor on my bachelor's nursing before. So I'm hoping that it'll go through.
And what hospital is Jennifer at?
Jennifer's at St. Joseph Hospital in Orange.
Didn't
Then,
Stephanie say we did have a contract with them?
yeah. So I'm just waiting for Stephanie's approval, like complete.
Okay,
Uh,
yeah, that should be good. So,
okay.
yeah. Yeah, I know. Let
Yeah,
me make a note to email her.
yeah, because I thought that I'm too late. I thought I'm the only one who doesn't have a preceptor, so I was about to give up.
No, and we can extend it, to 5 weeks. Yeah, you have
Okay.
until then. You just might have to do some weeks where you do go there twice.
Okay, yeah, I understand.
Yeah.
And if I don't get any response by Stephanie but tomorrow, should I keep looking?
Let me email her tonight and we'll see what she says. I see she's just sent some emails here. So yeah, I think she's working on it right now. So
Okay, thank
get in
you.
touch with her. So St. Joseph's in Orange. Okay.
Yeah, it's
So
in
we'll get
Cat Lab. She's the manager at Cat Lab.
okay. Any other questions or comments or?
No, I think I'm good.
Okay. All right. Do you want to say a little bit about where you are now?
Oh, so right now I'll be working as a traveler at Kaiser Fontana, 3 days a week
Great.
for yeah, 3 months.
So Kaiser has its own travel company, doesn't it? Where you can travel with inside Kaisers at different locations?
I don't think so.
Oh, I thought they were
Yeah,
starting something like that. I thought it sounded like such
maybe.
a great idea. If you work at Kaiser and you want to go
Yeah,
somewhere different, they have a Kaiser Hawaii you can go to or
yeah.
something.
But Kaiser Irvine and Kaiser Anaheim, the
Mhm.
nurses there can go both hospital.
Yeah,
Like,
that's good.
yeah, they could.
What department do you work in?
Labor and delivery.
Okay, right.
Yeah.
You and someone else in the course, right? Is there
I
anyone
think
else?
Candy Bernal is
Mm-hmm.
labor and delivery or
Yeah,
postpartum.
yeah. Good. Okay. Well, thanks for sharing.
Okay, thank you.
And Vincent, last but not least,
Hey everyone, it's Vince.
Vince.
Thank you for the introduction. Um, so I currently work at community-based adult services for 3 years now. So I started there 2016. Before that, I worked at skilled nursing facilities for 6 months, and then it was difficult. So then I transitioned and found this adult day services. So at first I walked in there, I didn't know adult services exist. Um, so that was my first time walking into a facility. So what we do is basically provide nursing services and other professional services like social work, um, PTOT, recreation, and that's funded by the CMS. So most of our clients we call participants are funded by Medi-Cal, or so they have medical insurance or Medicaid. We do accept Medicare, but for some reason they have limited coverage. For example, medical patients can attend the center for 5 days a week. We had one Medicare patient from, I think, some other insurance, not Cal Optima, but he was only able to attend 12 days in a year.
Wow.
So yeah, so a little bit different. So most of our patients are also we are mixed culture. We have Middle Eastern patients, Hispanics, and other cultures too. So the center I worked for before, because now it's closed. So our last day was Friday. We had mostly Iranian population clients. So it's a little bit challenging, in terms of communication. Um, interacting with patients, mostly adults, and we also have mostly the senior population. So now that my center is closed, that was my intention to do the practicum with our administrator, and as also perhaps our CEO, who has a master's degree in business administration. But unfortunately, our center is temporarily closed. So I hope I can do the preceptorship in Bakersfield with their PACE program. So it's kind of the same. PACE is also for mostly adults, at least 55 years or old, and most of them have either Medicare, medical, or both, and it has stricter criteria. Um, I think because they have more, they are managed with a different, for example, state funded probably compared to community-based adult services. The funding may not be as much as compared to PACE. So it's a different program, but it has some similarities too. Like the PACE program has its own adult daycare program. On top of that, it also has primary care services, all on the same site. So it's kind of cool, like an outpatient clinic that has services, professional services, as well as adult daycare. So it's nice because I really enjoy working in public health, working in the community, especially when we can provide care and services to the elderly population when their families go to work in the daytime, so that they can continue to provide basically care for their growing family too. So it's kind of fulfilling and meaningful for my part. So at this time, I'm waiting for Miss Stephanie to approve my uh, practicum in PACE program in Bakersfield. So I'm just waiting on that.
Let's email her again. I was looking at the spreadsheet with everyone on there, and all she has on for you is that that it closed. I see she's in the spreadsheet right now. Stephanie's in it. It's a Google sheet, so I can see her in there. So let's get in touch with her today to make sure, because I emailed her that I approved the CEO, and I know she got that email, so we should be good. Are you going to work in Bakersfield?
At this time, I don't think I'm gonna work in Bakersfield. So
Okay,
my
I think
plan is just
that's
to
good.
do one
Yeah,
time a week
okay,
volunteer.
right. Because your preceptor is not supposed to be your direct supervisor. So if you were working there, that might be a conflict. So I think that's good. So are you not working now at all?
Now at this time, I'm currently looking for work.
And you're a full-time student. Like
Yes, and a
that's
full-time
enough.
student.
Are you taking another class right now, Vincent?
Yes, I'm
Vince, sorry.
taking healthcare informatics.
Okay. That's a good mix. Is anyone else taking informatics? Eileen?
Eileen's there.
Yeah, yeah. Good. All right.
We've
Well, we should.
me and Eileen we go back for
Yeah,
almost
we had
2 years
quite a
now.
few classes together.
Yeah.
Right.
You guys were kind of in the same cohort there, so that's
Yeah.
nice. Great, great.
Oh, Dr. Gio, I just sent you and Stephanie Huntington Memorial Hospital, Michelle's information.
Okay,
And
very
I
good.
attached some document to her. She said that okay, I guess it's 4:30 already. She said she leave at 4:30, so I guess tomorrow she will look at it.
Yeah. Okay.
And if it's possible, I would like to have Stephanie talk with her, so maybe clear something. I know Huntington is a teaching hospital for USC Medical School, and another USC student there because USC, they just started FNP program
Oh, Okay, well, I'll take a look at it when we're done with our little meeting here.
Yeah. Okay.
All right, well, it sounds like you guys are just overcoming challenges one after another. So keep up the good work. Is there anything that I could have done to make this a little bit easier? Was there anything that you felt like kind of blindsided you that you didn't have enough information about? I'm just thinking for the next time I teach 543, is there more information you would have liked up front? Okay.
I wouldn't say more information up front, maybe just, I guess, the communication with Stephanie. I think that's what kind of delayed the process, because I know that having confirmation of acceptance of an actual clinical site, um,
I
I
have
guess we're
to
not
agree with
sure if we can
Ivy.
start.
Okay.
And that has been a challenge to actually connect with her and get reply from her. Because
Okay.
if she would tell me earlier, I would have done this earlier.
Right. Okay.
I understand it's holiday season. Everybody needs a break from the holiday, but not replying, that kind of bothered me a lot, because I guess we all in the same position. You just don't not reply people, period.
Right. Right. And I think next time we do have our Jennifer Elrod is our new program manager for HAL. So she's going to do all the Castle Branch stuff. So Stephanie will only have to do the clinical placement. So hopefully taking that load off of Stephanie. We were in between program managers, so that put, and this is the biggest HAL 543 course that we've had. So I think that maybe took her. She wasn't prepared for all of this as well. So.
Oh, okay. With the Castle Branch, we are the ones submit the document. I would like to know on her side, what does she have to do?
I have no idea. I don't work with Castle Branch, so I can't tell you.
Because Castle
All I
Branch,
get is
how
an
it works
email
is
when you're done.
Yeah. I mean, we are the one have to collect the information and submit everything. And Castle Branch kind of look through it and approve it, and that's it.
Yeah, I'm not sure. But the good news is when you do go to your next clinical, which is 567, you'll have almost everything done, probably everything done. There might be something that you just need to update, you know, if a vaccine's out of date or something like that. But all of this should be done. Everybody can do their next practicum experience at the same place you are now. If you think that's a good fit for you, you can build on the work that you do during this practicum for 567. If you feel like you want some different experiences or you weren't too happy with where you were, you know, maybe now is a good time to start looking for your next clinical site for 567. So just email me if you, if you know already, or if you think you want to change. And I know we're just getting into this one, so kind of hard to already be thinking about 567. But never, I think you can never start any of this too early. There is a shortage of preceptors, so that makes it a little difficult.
Do you have any suggestions or advice as far as clinicals go that you've seen in previous classes at all?
Well, you know, did you get the video I sent of the student who was talking about her clinical experience? That was one thing that she kind of shared. That was an announcement that went out, right? The video.
Right.
And I think sometimes when you're in a clinical and people say, okay, your leadership and management, they say, okay, well, why don't you help me do this leadership and management stuff? But so you can kind of, if that happens to you and they ask you to do like a schedule, you know, can you schedule these nurses for me, which happened, you can kind of bring them back and say, look at the syllabus, and these are the objectives that I'm supposed to complete during this experience, this practicum experience here. And I've also broken the calendar down into some ideas of what you can do each time, but you don't have to stick to that. There might be that something like, say, one time we had Kaiser was about to go out on strike, so the nurse that was at that Kaiser got to go to all these high-level C-suite meetings and learn about what would go on and how they might organize, and all the things that a manager might have to do right before they go out on strike. So that was a great experience. So just because this is care management, there's going to be other opportunities that come up when you're at your site. So I would say, if you have any questions about if that's something you should be doing, just send me an email. This is not a direct patient care clinical, so you shouldn't be doing any assessments or doing any treatments or anything that with patients. It should be mostly looking at how systems work, how patients are encountering a healthcare system, how regulations, how all these things tie together and integrate to make it so a patient has a good experience throughout different settings. So that was a great question, Ivy. There's, I would say if you have questions, just send me an email. But you're going to be exposed to a lot of different things. So I would be judicious about what you say you can and can't do.
Okay, sounds good.
Anybody else? Okay, well, I really appreciate you guys being here, and I guess I will see you in Canvas. See you. Okay.
All
Peace.
right. Thank you so much.
All right, you're welcome.
Bye,
Bye, everyone.
everyone.
Good night.
Nice seeing you, Vincent. Finally.